All right. Welcome to the show. PAs in the building today and joined by Michael Pyne from Healthwest. Mike, how you doing?
I am good. I wish I was in Florida, but somewhere
Man,
warmer would be nice. Somewhere
it's
warmer.
it's only 62 degrees outside.
I'd take it. I would take it.
They're talking about a high of 48 on Saturday
Really?
on here in Orlando.
Wow. Okay, so
Yeah,
you're gonna
that
get it.
is
You're gonna get a little bit of this.
so so how you doing, my friend?
I'm good. We're busy. We're always busy. That's an understatement, probably, but yeah, I'm doing good. I'm gonna have some time off for the holidays here, so I'm gonna take care of myself and my own mental health, hopefully over those days, which maybe we can talk to people about doing for themselves as well.
Good. Definitely a good topic. I'm glad that you were able to talk about this. We saw what happened last week with Twitch, the,
Yeah.
the DJ for Ellen DeGeneres, and the shocking discovery that he committed suicide.
hmm
And
You know, and I have to say, what an interesting thing. I mean, it's always tragic, right? When somebody who's in the public eye dies by suicide. But man, that seemed to really rock people on all levels. Like there was a guy who apparently touched a whole lot of people out there in the world. And I remember when I heard it too, I was shocked, but it's had staying power. It stayed in the news for a while. And of course, I want to be respectful and I want to give people the opportunity to mourn. But there's always risk the longer things stay in the media around suicide. You know, whenever somebody famous dies by suicide and it makes the media, there's a spike in suicides out there in the community. And of course, this being an African American gentleman and the risks in the African American community are increasing. I just hope that as people share the story about Twitch, that they're also sharing resources like you're doing right now on the screen. And really, it's as simple as dialing 988 to get help at this point. Those numbers, we're up and running in Michigan for the most part with a 3-digit 988 is the suicide lifeline. You can call it just for help. But I would encourage people that are sharing that story on social media just to go back and just say, hey, if anybody's reading this, if you're struggling at this time, here's where you can turn for help, and just give them that 3-digit number 988. They can call or text it. But as these stories are in the news, you know, it's one of those things that can really weigh on us and start to have an impact on us too. It's just tragic. And so I hope everybody is taking care of themselves, and we're going to see these stories pop up periodically, but we have to know that it also impacts us. Even if we're not related, distant from somebody, it can still have an impact on us.
so, so Mike, Twitch could have been dealing with some things at the same time while he gave out the image of being happy, or it could have been something that just happened spontaneously that pushed him over the edge.
Yeah, you know, there's the thing with suicide is a lot of times people want to have a real quick short that's what we want as people about everything, a real quick short cut and dried answer. And the truth of the matter is that suicide is usually very, very complex. Many of us have been bullied and we haven't died by suicide, right? Many of us have gone through a divorce or heartache or a death of a loved one really close to us, and we haven't died by suicide. And the majority of us can get through things and we do okay. But what normally is involved in suicide is a combination of things that are piling up, piling up, piling up. And then you might have the straw that breaks the camel's back, which could be bullying. It could be a substance use problem. It could be financial stuff, but it's usually not a simple one thing only. And I would urge people to really be careful about thinking about it as a one thing only situation, because if and when we do that, we sort of eliminate the broader discussion about suicide and how complex it is. And there's usually, so I don't know about this gentleman and what he was going through, but more than likely it's more than one thing. And and it's not always mental health either. Many people die by suicide who have not been diagnosed with a mental health concern. So it's hard to know, but it's a very complex thing. There's usually many things that are piling up. It becomes overwhelming, and then there's some straw that breaks the camel's back, so to speak.
We got some comments online. How you doing, Andre Kitchen? Thanks for checking in, man. He has a comment that says, I know a lot of veterans who suffer from depression and PTSD, and most of us veterans don't get the much needed help that we require.
I will say that it is tricky, right? We hear a lot about veterans, and it's sad, very challenging and very sad. I do think that the Veterans Administration in the past year or so is beginning to approach the problem with a different view. For many years, I went to veteran suicide prevention events, and I will just be honest in saying I always left disappointed. I myself am not a veteran. I would go thinking, okay, now's the time we're going to learn how to help veterans. And predominantly the audience is veterans. And within a short period of time, you could see the veterans were asking questions of those from the VA that they really couldn't answer. And it would end in frustration, and I would feel bad. I want to think that the recent changes in the way that the VA is starting to approach suicide will hopefully be helpful. But what I would suggest is this. If somebody is struggling, here in Muskegon too, you can call 722-HELP, 722-HELP. And if you're a veteran and you do dial 988, the very first question you get asked when you dial 988 is, are you a veteran? Push 1. If you're a vet, you talk to vets. And that's an important thing to know. We also have a veterans navigator at Healthwest that will help veterans to navigate the system. You can call and say, I'm a vet. There are vets who prefer not to go to the VA who will come to us. And so Healthwest is also there. And I would just say call 722-HELP if you're just looking for a way to learn. 722-HELP is going to put you in touch with what we call our warm line. You can call it just to talk to somebody if you're struggling. You can call it to ask about services. You can call it to ask for an assessment, an emergency assessment. And so I would put that out there as well. That's here in Muskegon County is 722-HELP. And then we just got to reach out to each other. The bottom line is we got to reach out. And if you got a circle of veteran buddies or something, once a month, you got to reach out and go, okay, how are we doing with our mental health? It's a small thing. And I'm not saying it's going to cure PTSD, but we got to be there for each other.
Yeah, and thank you for your service, Andre, and all the other veterans. So I am a fellow veteran myself. We got a comment from Janine Lacey. It is so hard for someone to admit that they are not okay, especially to those who they look okay to people, but don't know how to handle it. So it leaves them psychologically isolated.
Right. There's a lot of reasons that people do not want to admit that they're having a problem, right? And here's where the real issue comes in as human beings. We have this idea in our head that somehow a mental health concern, when our brain doesn't work right, an organ in the body, right? Our brain is an organ in the body and it's not working right. And a lot of times we have this stigma and this weight that we carry that says it's somehow a personality flaw, or it's somehow a personality flaw or some character defect, or we're not working hard enough, or we're not praying hard enough. We hear this a lot. But we normally don't connect those things to like kidney disease, liver disease, even lung disease. If you smoked your whole life, maybe somebody goes, you shouldn't have smoked, right? Maybe. But the stigma isn't, you're still going to get help. And you're still going to be willing to admit to your doctor, hey, I'm having a hard time. And what we need to do to make that conversation come full circle is we've got to put it onto the medical model. This is about a brain that isn't working the way we wish that it would. And this can happen for all kinds of reasons. A car accident that we walk away from, but maybe we thought we could have died, right? The death of a loved one, a divorce, depression, organic problems with the brain. If you had lung disease, if you had liver disease, you'd go find the expert to help you. If your brain wasn't working correctly, though, somehow we wait. And Americans wait an average of 11 years to go get help for a mental health problem. 11 years. Wow. If you broke your arm, Paul, and you came to me and I went, man, I don't know, that looks like a break. if you waited 11 years, you're going to have some real problems getting that arm to come back fully for you. And it's hard for a brain to bounce back after 11 years too. So my advice is go early, seek help. And it may be hard. Those first steps may be hard. 722 help, bounce some questions off of people anonymously. Hey, here's another one, mantherapy.org. I throw this out there for men. Men especially don't like to admit maybe they're having a problem, but women can go there too on behalf of their men. But mantherapy.org, it's got a little humor to it. It approaches it differently. You can go do a head inspection, which is essentially a depression screening. You can go learn about anger management and angry outbursts that you may be having, anxiety concerns. And it's a way for you to start that process from your living room and go, okay, where am I at? But the bottom line is we got to destigmatize this and we got to treat it for what it is. It's a medical concern.
Well, Michael Pyne here. We talking about depression and suicide, holiday depression. How do we fight it off?
Oh, holiday depression. Now we're right into those days too. You know, my advice to people is always this: don't say yes to everything if you don't want to say yes to everything. I was just having this conversation with my cousin yesterday, right? We feel like the old guys in the house who go, I don't want to go to the relatives, those crotchety old guys who maybe don't want to do all this stuff. It's not that I don't want to see family. There are stressors and there are certain things that maybe are uncomfortable, but a lot of times we can take on more than we can handle, spend more than we have, that then weighs on us. And so a lot of the practice around the holidays has to start happening before the holidays. Set a budget. Let people know what you will and won't do, what your calendar says you can and cannot do, and try not to feel guilty about those things that maybe you just don't have the energy to do. But also through the process, find some time for some self-care, mindfulness, sitting in meditation, prayer. Find those things that, you know, walking in nature, whatever it is, a bubble bath, anything. Work on yourself and don't feel guilty about paying attention to your needs and what's out there. But I would avoid those things that end up causing us the real grief even after the holidays, right? The credit card bills start to roll in. Maybe people are disappointed they didn't get to see folks, all kinds of things. Having to sit with a relative at the, you know, Christmas table who's not particularly easy to sit with. All of those things are stressors, right? We got to figure out how to manage them. It's challenging. It's challenging.
Some online comment, Janine Lacey. In the Black community, generationally, we are taught all the weight we carry makes us tough. The strong Black woman or man.
You know, that's a tricky one for an old white guy here, right? But here's what I'm going to tell you, and I may be wrong. PA, you've always been really good. Every time I talk to you, I get an education, seriously. But here's what I will say. For many, many years, I've been working in social work for 38 years, and I've seen the suicide rate, specifically the suicide rate within the African American community, has been very low. It's been relatively low compared to white folks and other folks. And now we're starting to see it increase. African American children, second leading cause of death is suicide. African American adults think about suicide seriously at the little bit more than their white counterparts. Suicide attempts within the African American community are starting to equal their white counterparts. And we're starting to see a real problem within the African American community. And I have a theory. I may be wrong, but I do think generationally there are certain cultures, not just the African American culture, the Asian community and some other cultures that are out there will come around family when things aren't going well, will be supportive of each other, strong church connections and ties. They will bring a plate of food to somebody who may be struggling. And I think we're maybe starting to see that start to go away more and more. This is a guess on my part. And we're also seeing more of a melting pot in children in schools. You know, their white counterparts, they may be very close friends with, and they're starting to learn also from each other. That's one of my theories. So I don't even know if it's just about being strong and trying to hide things, because I see that in white culture. I see that in the Asian culture still too. A lot of stigma, but I think we still have to get back to putting it on the medical model. You know what? My brain's not working right. I'm not able to focus. I'm not able to concentrate. What should I do?
Well, my theory that during the pandemic, we lost contact with people that made us strong that made us happy, that made us smile. We lost contact with the mothers in the church. Church meant means a lot to the black community. It was our place of refuge during the struggle. It
Mhm.
always been a place of a refuge, spirituality, and I think during the pandemic we lost that, and I don't know. I hope it come back, but I definitely see a connection there that as the church attendance goes down, suicide rate was going up along with other things. So I even saw it in the village. We had a lady in the village in Africa where suicide is very low
Mhm.
over the summertime. Hung herself.
Mm.
Yeah. So it's happening, globally. So anyway, we got some more comments from Andre Kitchen. I totally agree. He's right. Most people of color have always been led to believe that psychiatric treatment isn't available, and also taught to keep it in the house. But that's the worst thing to do. Uh,
It is.
People that are suppressing these things and holding back their emotions, holding back their feelings. Uh, what are your thoughts on that?
Yeah, I think you get that in a lot of different cultures too, right? Let's not talk about it. Let's not share that. I think it's worse in the white community, frankly, and the approaches have been different. My thing is this: if you know of somebody within the community, church community, the neighborhood, friends, family, if you know of somebody who is struggling emotionally, struggling with a mental health concern, we have to, I would just encourage people to come around that family, that individual, the same way you would if they just had a surgery or they just came out of a car accident. Maybe who's going to, a schedule for who's bringing a plate of food. Come around that family, right? And those are the things. This happens in some European cultures with mental illness. The community comes around that person. It happens on the African continent with many groups will come around that person and support that person through that time with mental health here. This isn't just about physical health, with mental health I'm talking about. And those cultures that do that use fewer psychotropic medications and they have healthier communities. And so my fear is I don't see it particularly in the white community. What I see a lot is, here's my family member who has a mental illness or a substance use concern. Take them, get them well, and send them back. And on some level, yeah, that's not how the system totally works. If you broke your leg in 5 places, let's say you were even doing something foolish that you shouldn't have done, right? Well, I don't know why you were standing on the roof of that car going down the road. You shouldn't have broke your leg. Maybe I'm going to say something, right? But if you come home and everybody ignores you and they don't want to come near you with that broken leg, you are going to heal slower. And the same is true for a mental health problem. If people ignore you in the grocery store or they don't want to come to your house or you're keeping it a secret, when people come around and support people through those illnesses and those times, they heal quicker and they heal better. It takes time.
Janine says alcohol purchases went up, porn use went up, and the things that we were not dealing by being busy was brought to the surface in the pandemic.
Yeah. Yeah.
Um, the term crazy, is that a bad term to use?
It is a term we shy away from. We don't want to use it. People use it all the time. I'm not the word police. If somebody says, wow, I was crazy busy, out there in the world, I don't stop people, right? If people I work with in the mental health field use the term loosely in those ways, I do discourage them from doing that. Right? I say, hey, you may not want to use that term that way, right? It's a hard thing to hear, especially if you're someone who has gone through treatment, been in a psychiatric hospital. So it's one of those words I would encourage people to think about when they say it and the impact that it can have on folks. But it's these, and then we'll find some other term to describe it, and in 20 years we'll be going, don't use that anymore, right? That's the nature of language. So
How
we
do you
just
use the term? I mean, because let me give Kanye West. People can tell that he's not well.
yeah.
How do we describe these situations without belittling an individual?
Right, exactly. And you don't want to be dismissive. I look at this Kanye West situation and I think to myself, I'm watching a man deteriorate, in my opinion. Okay. I'm watching a man deteriorate publicly in what to me is a tragic situation, right? I'm not even commenting on his comments. True, fault, what, picking a side. I'm not picking a side. I'm looking at a man who I feel like is suffering. I know his family has got to be struck. This is 38 years worth of experience. And, divorce, children have been taken from him. All kinds of things are happening out there. And we'd love to watch powerful people. For whatever reason, we look at it as entertainment, and it isn't. It's a tragedy, and it's a sad situation. But in that scenario, and he may hold these beliefs, without having a mental illness, but by his own admission, he has mental illness, and he has for many, many years. By his own admission, he will not take the medications that are prescribed for him. And I understand they're challenging and they're difficult. But with that alone, we should be able to look at Kanye and quit parading him around to get clicks on, news stations. And I just, I want him to get some help. And I feel for his children. I feel for his family, and I feel for him. But I wouldn't describe him.
If we have a Kanye in our family,
Mhm.
how do we handle that? We know somebody's not well.
So let's say they're resistive, you mean?
Yes.
To treatment? Oh, these are the trying ones. This is again, and here's the deal. According to Kanye, he's been down that path and he's been in for treatment. And then he disagrees with the treatment, or he stops taking medication. Then he begins to deteriorate, goes back, then he gets well, then he stops. So he's even been on again, off again. But here's where, again, I think, the best we can do is with that family member, that friend, is just say, at this point, it seems as though you've got this illness that's rearing its ugly head again. This is a medical problem. We need to go talk to the people who work with brains to at least have a conversation with. We got to put it on that medical model and quit making it seem like somehow we have some control over it. The reality is we don't always have total control over our mental health. And I think that it comes down to having that conversation with as little frustration in our voice as possible. When you've got that family member who will not go get help for a substance use problem, will not go get help for a mental illness, it's frustrating. It causes anger. It causes anxiety and sorrow and sadness, all of these emotions. And so it's really easy to yell at that person or to ostracize them and kick them out of the home. And I think the thing is, I don't know about a Kanye who's got more money than I'll ever know, but I have a family member today. She's coming home from rehab. Bless her heart. I love her to death. For 15 years, I've been telling her, the day you want help, I'm here for you, right? But you can't call me up and ask for $25. I'm not going to give it to you. When you begin to make good choices for your health, I love you. I'm gonna be right there. We'll pay the rent. We'll make sure the refrigerator's full. When you make good choices. First time in 15 years, she decided to go get treatment. She's coming home today. It's a slippery slope, right?
Right.
But as soon as the family member begins to make those positive choices, then we really got to come around and support that person through those choices. And medications are challenging and they aren't always pleasant to take. And having a mental illness diagnosis isn't fun. And the stigma is there. And we have to be supportive of that person. It's challenging. And 15 years in my family with just this one family member, I didn't think she was ever going to go to rehab. And I was kind of preparing for the worst of the worst, frankly.
Wow.
And I don't know what tomorrow brings, but I know this. She went for help. And at this point, I'm going to work with her on everything that she needs. And so is the rest of my family, right? Because I demand that they reach out to her, help out, pay the rent for a little while, make sure she's got what she needs as long as she's making those good choices. I love her when she's making bad choices too. I love her to death, and I tell her that when she reaches out to me. I love you when you're making bad choices too, and that's okay. But when you start to make choices for your health in a positive way, I'm going to be here in ways you never thought I would be. And that's what we need to do too. Put it on the medical level.
Wow. Mike, anything else before we go?
Hey, no, I just think it's going to take a lot of people coming around each other, loving each other, supporting each other during these stressful and difficult, challenging times. And if anybody needs anything in Muskegon County, 722-HELP, almost 24 hours a day. In January, we're close to 24 hours a day with that line. We're coming to you. And 988, if you don't want to talk to us in town here, you can call or text 988. and they're going to help you out. Hopefully everybody has a wonderful Christmas and a great new year. In 2023 will bring more positivity. Let's hope. Okay.
Thank you so much, Mike Pyne. You're always on point, man. It's always good to talk to you. 26 minutes went very quick, and we appreciate the online comments to carry this conversation forward. God bless you, my friend. Have a great holiday. We'll be talking.
Thanks, Paul. Yeah, you too. And hey, Stephanie and I are here for you. Let us know what you need moving forward. We're going to be here every month, I understand. So
I love it. I love it. Thank you, Stephanie. Thank you, Stephanie. Take care.
All righty. Bye-bye.